Introduction to sex therapy. Sex therapy is a specialized form of psychotherapy that addresses sexual concerns and dysfunctions in individuals and couples. It aims to help clients overcome challenges related to sexual function, desire, pain, and intimacy, fostering a healthier and more satisfying sexual life. This field recognizes the multifaceted nature of sexuality, integrating biological, psychological, and sociocultural factors into its therapeutic approach. Therapists in this area work to create a safe and non-judgmental space for clients to explore sensitive topics. The ultimate goal is to enhance sexual health and overall well-being. Understanding the scope and purpose of sex therapy is crucial for effective practice. It is a vital component of holistic healthcare. The role of a sex therapist involves conducting thorough assessments, developing individualized treatment plans, and employing evidence-based interventions. Therapists educate clients about sexual anatomy, physiology, and response, dispelling myths and providing accurate information. They also guide clients in improving communication skills, reducing performance anxiety, and exploring their sexual identity. Sex therapy often involves homework assignments, such as sensate focus exercises or communication practice, to facilitate progress outside of sessions. This collaborative approach empowers clients to take an active role in their healing journey. The profession demands empathy, discretion, and a deep understanding of human sexual experience. Historical context and evolution. The understanding and treatment of sexual issues have evolved significantly throughout history, influenced by cultural, religious, and scientific perspectives. In ancient civilizations, sexual practices were often intertwined with spiritual beliefs and fertility rituals, with little distinction made for individual sexual well-being. Medieval Europe saw sexuality largely suppressed and pathologized by religious doctrines, leading to widespread shame and secrecy surrounding sexual matters. The Victorian era further entrenched these restrictive views, often attributing female sexual issues to hysteria and male issues to moral failings. This period marked a time of significant medicalization of sexual problems, though often without effective or empathetic treatments. Early medical approaches were often invasive and lacked a psychological understanding of sexual function. These historical contexts highlight the long journey towards a more enlightened approach. The late 19th and early 20th centuries brought the pioneering work of figures like Sigmund Freud, who introduced the concept of psychosexual development, and Havelock Ellis, who advocated for a more scientific and tolerant view of sexuality. However, it was the groundbreaking research of Alfred Kinsey in the mid-20th century that truly challenged prevailing societal norms by providing empirical data on human sexual behavior. Masters and Johnson, with their direct observational studies of the human sexual response cycle, revolutionized the field in the 1960s, establishing sex therapy as a distinct and legitimate discipline. Their work shifted the focus from moral judgment to a medical and psychological understanding, paving the way for modern, evidence-based sex therapy practices. This evolution continues today, incorporating new research and diverse perspectives. Ethical principles and professional conduct. Ethical practice is paramount in sex therapy, given the sensitive and intimate nature of the topics discussed. Therapists must adhere to strict ethical guidelines to ensure client safety, trust, and well-being. Key principles include maintaining confidentiality, obtaining informed consent, and avoiding dual relationships that could impair professional judgment. Therapists are also responsible for upholding professional boundaries, ensuring that personal feelings or biases do not interfere with client care. Competence is another critical ethical consideration, requiring therapists to practice only within their areas of expertise and to continuously engage in professional development. These principles form the bedrock of responsible and effective sex therapy, protecting both the client and the integrity of the profession. Adherence to these standards builds trust and fosters a safe therapeutic environment. Managing personal values and biases is a significant ethical challenge for sex therapists. Therapists must be self-aware of their own beliefs about sexuality, gender, relationships, and cultural norms, and ensure these do not negatively impact their clients. It is essential to approach each client with an open mind, respecting their unique experiences and perspectives without imposing personal judgments. Furthermore, therapists must be vigilant in identifying and addressing any potential conflicts of interest. Supervision and consultation with peers are invaluable tools for navigating complex ethical dilemmas and ensuring professional accountability. Maintaining a high standard of professional conduct is not only an ethical obligation, but also a cornerstone of effective and trustworthy therapeutic practice. This commitment to ethical integrity safeguards the therapeutic relationship. Understanding human sexuality. Human sexuality is a complex and multifaceted aspect of life, encompassing biological, psychological, social, and cultural dimensions. It is not merely about physical acts, but also includes identity, attraction, desire, intimacy, and reproduction. Understanding sexuality requires acknowledging its fluidity and diversity, recognizing that it manifests differently across individuals and throughout the lifespan. Factors such as gender identity, sexual orientation, and relationship structures all contribute to an individual's unique sexual experience. A comprehensive view moves beyond simplistic definitions to embrace the rich tapestry of human sexual expression. This holistic perspective is fundamental for any practitioner in sex therapy. It allows for a more empathetic and effective approach to client care. The biopsychosocial model provides a valuable framework for understanding human sexuality. Biologically, it involves hormones, neurochemistry, and physiological responses, which underpin sexual desire and function. Psychologically, it encompasses thoughts, emotions, beliefs, and past experiences, all of which profoundly shape sexual attitudes and behaviors. Socially and culturally, sexuality is influenced by societal norms, religious teachings, media portrayals, and family upbringing. These external factors often dictate what is considered normal or acceptable, impacting an individual's comfort and expression of their sexuality. Integrating these three dimensions allows sex therapists to address the root causes of sexual concerns comprehensively. This model helps in developing tailored interventions that consider the whole person. Sexual anatomy and physiology. A fundamental understanding of sexual anatomy and physiology is essential for sex therapists to accurately assess and treat sexual dysfunctions. This includes detailed knowledge of both male and female reproductive and sexual organs. For males, understanding the penis, testes, prostate gland, and their roles in erection, ejaculation, and sperm production is crucial. For females, knowledge of the vulva, clitoris, vagina, uterus, and ovaries is necessary to comprehend arousal, orgasm, and reproductive processes. Beyond the physical structures, therapists must also grasp the intricate neural and hormonal pathways that regulate sexual response. This foundational biological knowledge allows therapists to differentiate between physical and psychological causes of sexual concerns. It also enables effective client education regarding their bodies. Accurate information empowers clients to better understand their own experiences. The human sexual response cycle, as described by Masters and Johnson, consists of 4 phases: excitement, plateau, orgasm, and resolution. The excitement phase involves vasocongestion, blood flow to the genitals, and myotonia, increased muscle tension, leading to erection in males and clitoral engorgement and vaginal lubrication in females. The plateau phase intensifies these changes, with further increases in heart rate, blood pressure, and breathing. Orgasm is characterized by rhythmic muscle contractions throughout the pelvic region, followed by the resolution phase, where the body returns to its pre-arousal state. Understanding these physiological processes helps therapists identify where in the cycle a dysfunction might be occurring. This knowledge is key to targeted interventions. It also helps normalize various sexual experiences. Psychological aspects of sexuality. Beyond biology, psychological factors play a profound role in shaping an individual's sexual experiences and well-being. These factors include self-esteem, body image, anxiety, depression, and past traumatic experiences. Negative self-perceptions or body image issues can significantly inhibit sexual desire and enjoyment, leading to avoidance or dissatisfaction. Performance anxiety, a common concern, can create a self-fulfilling prophecy, making it difficult to achieve or maintain arousal. Mental health conditions like depression and anxiety often reduce libido and can interfere with sexual function. Unresolved psychological trauma, particularly sexual trauma, can have long-lasting and complex impacts on an individual's ability to engage in intimate relationships and experience sexual pleasure. Addressing these psychological underpinnings is crucial for effective sex therapy. It requires a sensitive and empathetic approach. Cognitive processes such as beliefs, expectations, and interpretations also heavily influence sexual response. Dysfunctional sexual schemas or deeply ingrained negative beliefs about sex can lead to self-sabotaging behaviors and emotional distress. For example, believing that sex is inherently dirty or that one is an inadequate sexual partner can create significant barriers to intimacy. Communication patterns within relationships, including openness, trust, and vulnerability, are likewise psychological determinants of sexual satisfaction. Poor communication can lead to misunderstandings, unmet needs, and resentment, all of which impact sexual connection. Sex therapists often work to identify and challenge these unhelpful cognitive patterns and improve relational communication. This helps clients develop healthier and more realistic perspectives on sex and intimacy. Sociocultural influences on sexuality. Sociocultural factors profoundly shape how individuals perceive, express, and experience their sexuality. Cultural norms, religious doctrines, societal expectations, and media representations all contribute to the formation of sexual attitudes and behaviors. What is considered normal or taboo varies widely across different cultures and historical periods, impacting sexual freedom and comfort. Religious beliefs often provide strict guidelines on sexual conduct, marriage, and gender roles, which can create internal conflict for individuals whose experiences diverge from these teachings. Societal expectations regarding gender roles, masculinity, and femininity also influence sexual scripts and power dynamics within relationships. These external pressures can lead to shame, guilt, or anxiety surrounding sexual expression. Understanding these influences is vital for culturally competent sex therapy. It helps therapists contextualize client experiences. The media plays a significant role in shaping public perceptions of sexuality, often presenting idealized or unrealistic portrayals of bodies, relationships, and sexual encounters. These portrayals can contribute to body image issues, performance anxiety, and unrealistic expectations for sexual satisfaction. Furthermore, cultural stigma surrounding certain sexual orientations, gender identities, or practices can lead to discrimination, marginalization, and internalized homophobia or transphobia. Family upbringing and peer groups also transmit sexual values and messages, which can be either supportive or restrictive. Sex therapists must be aware of these diverse sociocultural influences to provide inclusive and affirming care. They help clients navigate these complex external pressures. This awareness promotes a more holistic and empathetic therapeutic approach. Common sexual dysfunctions. Overview. Sexual dysfunctions are conditions that prevent an individual or couple from experiencing satisfaction from sexual activity. These dysfunctions can affect any phase of the sexual response cycle and are often multifactorial, stemming from a combination of biological, psychological, and relational issues. Common dysfunctions include disorders of desire, arousal, orgasm, and sexual pain. They are prevalent across all genders and ages, though their manifestations and prevalence may differ. Understanding the broad categories of sexual dysfunction is the first step in effective diagnosis and treatment. It is important to approach these issues with sensitivity and a non-judgmental attitude. Many individuals experience these challenges at some point in their lives. Sex therapy offers hope and solutions for these common concerns. Disorders of desire involve a lack of sexual interest or arousal. while arousal disorders specifically refer to difficulties in achieving or maintaining physical arousal. Orgasm disorders encompass delayed, absent, or premature orgasm, causing distress for the individual or couple. Sexual pain disorders, such as dyspareunia, painful intercourse, or vaginismus, involuntary muscle spasms, can make sexual activity uncomfortable or impossible. Each of these categories has distinct diagnostic criteria and potential underlying causes. Sex therapists utilize a comprehensive assessment process to identify the specific dysfunction and its contributing factors. This allows for the development of targeted and effective treatment plans. Recognizing the diversity of these dysfunctions is key to providing appropriate care. Male sexual dysfunctions. Diagnosis. Male sexual dysfunctions commonly include erectile dysfunction, ED, premature ejaculation, PE, delayed ejaculation, DE, and male hypoactive sexual desire disorder, MHSDD. Erectile dysfunction, the inability to achieve or maintain an erection firm enough for satisfactory sexual activity, can stem from physical causes like cardiovascular disease, diabetes, or neurological conditions, as well as psychological factors such as anxiety or stress. Premature ejaculation, characterized by ejaculation occurring sooner than desired, often has psychological components but can also be influenced by biological factors. Delayed ejaculation, a persistent difficulty or inability to ejaculate despite adequate stimulation, can be linked to medication side effects, neurological issues, or psychological resistance. A thorough diagnostic process is essential to differentiate between these conditions and identify their underlying causes. This often involves a combination of medical history, physical examination, and psychological assessment. Diagnosing male sexual dysfunctions typically begins with a detailed medical and sexual history, where the therapist gathers information about the onset, duration, and specific characteristics of the symptoms. This includes exploring relationship dynamics, stress levels, and any relevant medical conditions or medications. A physical examination and laboratory tests, often conducted by a physician, may be necessary to rule out biological causes, such as hormonal imbalances or vascular issues. Psychological assessment tools, such as questionnaires and interviews, help evaluate mental health factors, performance anxiety, and relationship satisfaction. It is crucial to involve the partner in the assessment process when appropriate, as sexual dysfunctions often impact both individuals in a relationship. A comprehensive diagnostic approach ensures that treatment plans are tailored to the specific needs of the client and address all contributing factors. Female sexual dysfunctions. Diagnosis. Female sexual dysfunctions encompass a range of conditions including female sexual interest arousal disorder, FSIAD, female orgasmic disorder, FOD, genitopelvic pain penetration disorder, GPPPD, and substance/medication-induced sexual dysfunction. FSIAD involves a lack of sexual interest or arousal, often influenced by hormonal changes, psychological factors like stress or body image, and relationship issues. Female orgasmic disorder is characterized by difficulty in achieving orgasm, which can be lifelong or acquired, and may be situational or generalized. Genitopelvic pain penetration disorder combines dyspareunia, painful intercourse, and vaginismus, involuntary muscle spasms, making penetration difficult or impossible. These conditions significantly impact a woman's sexual quality of life and often require a multidisciplinary approach for effective treatment. Understanding the nuances of each condition is vital for accurate diagnosis. The diagnostic process for female sexual dysfunctions involves a thorough medical and sexual history, focusing on the nature, onset, and impact of symptoms. This includes exploring gynecological history, hormonal status, medication use, and any history of trauma. A physical examination, often performed by a gynecologist, is crucial to rule out underlying medical conditions such as infections, anatomical abnormalities, or hormonal deficiencies. Psychological assessment evaluates factors like anxiety, depression, relationship satisfaction, and body image. It is particularly important to assess for a history of sexual trauma, which can profoundly affect sexual function and pain perception. Collaborative care between sex therapists, gynecologists, and other specialists is often beneficial for comprehensive diagnosis and treatment. This integrated approach ensures all contributing factors are considered, leading to more effective and holistic care. Sexual pain disorders. Sexual pain disorders such as dyspareunia and vaginismus significantly impact an individual's quality of life and ability to engage in satisfying sexual activity. Dyspareunia refers to persistent or recurrent genital pain associated with sexual intercourse, which can occur before, during, or after penetration. It can affect both men and women, though it is more commonly reported by women. Vaginismus is characterized by involuntary spasms of the muscles surrounding the vaginal opening, making penetration difficult or impossible. Both conditions can have a range of physical causes, including infections, hormonal changes, anatomical issues, or nerve damage. Psychological factors such as anxiety, fear, or a history of trauma also play a significant role in their development and maintenance. These disorders often lead to significant distress and relationship strain. Effective treatment requires a careful and empathetic approach. Diagnosing sexual pain disorders involves a comprehensive assessment that includes a detailed medical and sexual history, a physical examination, and a psychological evaluation. The physical examination aims to identify any underlying medical conditions, such as infections, skin conditions, or structural abnormalities. It may also involve assessing muscle tone and tenderness in the pelvic floor. The psychological evaluation explores the client's emotional state, past experiences, relationship dynamics, and any fears or anxieties related to sexual activity. It is crucial to rule out any history of sexual trauma, which can be a significant contributor to pain disorders. Treatment often involves a multidisciplinary approach, combining medical interventions, physical therapy, for example, pelvic floor therapy, and sex therapy techniques to address both physical and psychological components. This integrated strategy offers the best chance for alleviating pain and restoring sexual function. Paraphilic disorders and atypical sexual interests. Paraphilic disorders are characterized by recurrent, intense sexual urges, fantasies, or behaviors involving atypical objects, activities, or situations that cause clinically significant distress or impairment to the individual or pose a risk of harm to others. It is crucial to distinguish between atypical sexual interests, which are diverse and common, and paraphilic disorders, which meet specific diagnostic criteria for distress or harm. Many individuals have atypical sexual interests that are consensual, harmless, and do not cause distress. However, when these interests become compulsive, non-consensual, or harmful, they may be classified as disorders. Understanding this distinction is vital for ethical and effective therapeutic intervention. Therapists must approach these topics with sensitivity and a non-judgmental stance. While prioritizing safety, the focus is on distress or harm, not simply on atypicality. Diagnosis of paraphilic disorders involves a thorough clinical interview and assessment, often utilizing specialized questionnaires and tools. The therapist evaluates the nature, intensity, duration, and impact of the urges, fantasies, or behaviors, as well as the presence of distress, impairment, or risk of harm. It is essential to differentiate between paraphilic disorders and other mental health conditions that may present with similar symptoms, such as obsessive-compulsive disorder or impulse control disorders. Treatment approaches often involve cognitive behavioral therapy, CBT, to address cognitive distortions and develop coping strategies, as well as pharmacotherapy to reduce urges in some cases. The primary goals of therapy are to reduce distress, manage problematic behaviors, and prevent harm to self or others, while respecting the individual's autonomy and dignity. This complex area requires specialized training and ethical considerations. Assessment in sex therapy. A comprehensive assessment is the cornerstone of effective sex therapy. providing the therapist with a holistic understanding of the client's sexual concerns. This process involves gathering detailed information across multiple domains: biological, psychological, relational, and sociocultural. The initial assessment typically includes a thorough clinical interview, where the therapist explores the client's sexual history, current symptoms, relationship dynamics, and any relevant medical or psychological conditions. It is crucial to create a safe and non-judgmental environment to encourage open communication about sensitive topics. The goal is to identify the specific nature of the sexual dysfunction, its contributing factors, and the client's goals for therapy. A well-executed assessment guides the development of an individualized and effective treatment plan. It ensures that all relevant aspects are considered. Assessment tools in sex therapy may include standardized questionnaires, self-report measures, and psychophysiological assessments. Questionnaires can help quantify the severity of symptoms, assess sexual satisfaction, and identify specific areas of concern, such as desire, arousal, or orgasm. Self-report measures provide insights into the client's beliefs, attitudes, and emotional responses related to sexuality. In some cases, psychophysiological assessments, such as nocturnal penile tumescence monitoring or vaginal photoplethysmography, may be used to objectively measure physiological responses, helping to differentiate between physical and psychological causes of dysfunction. It is also important to consider partner involvement in the assessment process, as sexual issues often affect both individuals in a relationship. The therapist synthesizes all this information to formulate a comprehensive case conceptualization. This leads to targeted and effective interventions. Therapeutic approaches and interventions. Sex therapy employs a variety of therapeutic approaches and interventions tailored to the specific needs of individuals and couples. These interventions are often eclectic, drawing from different theoretical orientations to address the multifaceted nature of sexual concerns. Common approaches include cognitive behavioral therapy, CBT, psychodynamic therapy, systemic therapy, and mindfulness-based interventions. The choice of approach depends on the underlying causes of the dysfunction, the client's preferences, and the therapist's expertise. Interventions aim to reduce distress, improve sexual function, enhance intimacy, and foster healthier sexual communication. A flexible and client-centered approach is crucial for successful outcomes. Therapists continuously evaluate the effectiveness of interventions and adjust treatment plans as needed. This adaptability ensures that therapy remains relevant and impactful. Key interventions in sex therapy often involve a combination of education, communication training, and behavioral exercises. Psychoeducation provides clients with accurate information about sexual anatomy, physiology, and response, dispelling myths and reducing anxiety. Communication training helps couples express their desires, concerns, and boundaries more effectively, fostering greater intimacy and understanding. Behavioral exercises, such as sensate focus, are designed to reduce performance anxiety and increase pleasure by shifting the focus from goal-oriented sex to sensory exploration and connection. Other interventions may include mindfulness practices to enhance present moment awareness, or specific techniques to address issues like vaginismus or premature ejaculation. The integration of these diverse strategies allows sex therapists to address the complex interplay of factors contributing to sexual dysfunction. This comprehensive toolkit is essential for effective practice. Cognitive behavioral therapy, CBT, in sex therapy. Cognitive behavioral therapy, CBT, is a highly effective and widely used approach in sex therapy, focusing on the interplay between thoughts, feelings, and behaviors related to sexual function. CBT helps clients identify and challenge dysfunctional cognitive distortions, such as negative self-talk, unrealistic expectations, or catastrophic thinking that contribute to sexual anxiety or avoidance. For example, a client with performance anxiety might learn to reframe thoughts like "I will fail" into "I will focus on connection." By modifying these unhelpful thought patterns, clients can reduce emotional distress and develop more adaptive sexual behaviors. This approach is particularly useful for addressing issues like performance anxiety, body image concerns, and low sexual self-esteem. It empowers clients to gain control over their internal experiences. CBT provides practical tools for managing sexual challenges. Key CBT interventions in sex therapy include psychoeducation about the sexual response cycle, cognitive restructuring, and behavioral experiments. Psychoeducation helps normalize experiences and correct misinformation, reducing anxiety. Cognitive restructuring involves actively identifying and challenging negative thoughts, replacing them with more balanced and realistic ones. Behavioral experiments, such as sensate focus exercises or gradual exposure to feared sexual situations, help clients test out new behaviors and challenge their anxieties in a safe and structured manner. Homework assignments are often an integral part of CBT, encouraging clients to practice new skills and integrate changes into their daily lives. The structured, goal-oriented nature of CBT makes it a powerful tool for addressing a wide range of sexual dysfunctions. This evidence-based approach offers tangible strategies for improvement. Psychodynamic and systemic approaches. Psychodynamic approaches in sex therapy delve into unconscious processes, past experiences, and early relational patterns that may be contributing to current sexual difficulties. This perspective suggests that unresolved conflicts, repressed emotions, or attachment issues from childhood can manifest as sexual symptoms in adulthood. Therapists explore how these deeper psychological dynamics, often outside of conscious awareness, influence sexual desire, arousal, and intimacy. For example, a fear of intimacy might stem from early experiences of abandonment or betrayal, impacting current sexual relationships. The goal is to bring these unconscious patterns into conscious awareness, allowing clients to gain insight and work through underlying emotional conflicts. This approach emphasizes the historical roots of sexual problems. It offers a deeper understanding of complex issues. Systemic approaches view sexual problems not as individual pathologies, but as symptoms of dysfunctional patterns within a larger relational system, typically a couple or family. This perspective emphasizes that sexual issues are often maintained by the interactions, communication styles, and unspoken rules within the relationship. Therapists focus on the dynamics between partners, exploring how each person's behavior influences the other and contributes to the sexual concern. For example, a partner's criticism might inadvertently exacerbate the other's performance anxiety. Interventions aim to change these maladaptive interactional patterns, improve communication, and redefine roles within the system. Both psychodynamic and systemic approaches offer valuable complementary perspectives to CBT, providing a more holistic understanding and treatment of sexual dysfunctions. They highlight the interconnectedness of individual and relational well-being. Communication and intimacy skills. Effective communication and intimacy skills are fundamental to a healthy and satisfying sexual relationship. Many sexual concerns stem from or are exacerbated by poor communication, misunderstandings, or an inability to express desires and boundaries. Sex therapy often focuses on teaching couples how to communicate more openly, honestly, and empathetically about their sexual needs, preferences, and challenges. This includes active listening, expressing feelings without blame, and using I statements to convey personal experiences. Improving communication can reduce conflict, increase emotional closeness, and create a safer space for sexual exploration. It is a vital component of building and maintaining a strong sexual connection. Learning these skills can transform a relationship. Therapists guide clients in practicing these new communication patterns. Intimacy extends beyond physical acts and encompasses emotional closeness, vulnerability, and mutual understanding. Many couples struggle with non-sexual intimacy, which then impacts their sexual connection. Sex therapists help clients explore different facets of intimacy, encouraging them to engage in activities that foster emotional bonding, such as sharing personal thoughts, spending quality time together, or engaging in affectionate touch outside of sexual encounters. Building emotional intimacy can reduce performance pressure and enhance sexual desire and satisfaction. It creates a foundation of trust and security necessary for fulfilling sexual experiences. Interventions may include exercises designed to increase vulnerability, empathy, and shared pleasure. Cultivating both verbal and nonverbal intimacy skills is crucial for a thriving sexual relationship. These skills are learned and practiced over time. Working with diverse populations, sex therapists must possess cultural competence and sensitivity when working with diverse populations, recognizing that sexuality is profoundly shaped by cultural, ethnic, religious, and socioeconomic backgrounds. What is considered normal or acceptable in one culture may be entirely different in another, impacting clients' comfort with discussing sexual topics and their expectations for therapy. Therapists must be aware of their own cultural biases and strive to understand the unique perspectives and values of each client. This includes respecting diverse sexual orientations, gender identities, relationship structures, for example, polyamory, and abilities. Providing culturally affirming care means adapting therapeutic approaches to be relevant and respectful of a client's specific context. It ensures that therapy is inclusive and effective for everyone. This commitment to diversity enhances therapeutic outcomes. Working with LGBTQIA+ individuals requires specific knowledge and sensitivity regarding issues such as coming out, navigating discrimination, internalized homophobia, transphobia, and forming relationships within their communities. Therapists must be affirming of diverse gender identities and sexual orientations, using appropriate language and understanding the unique challenges faced by these populations. Similarly, working with individuals with disabilities requires an understanding of how physical or cognitive limitations may impact sexual expression and function, and how to adapt interventions accordingly. Addressing the sexual health needs of older adults involves recognizing age-related physiological changes, as well as societal stereotypes about senior sexuality. Therapists also need to be sensitive to the impact of socioeconomic status, immigration status, and religious beliefs on sexual health. A truly inclusive sex therapist continuously educates themselves and advocates for equitable sexual health care for all. This ongoing learning is essential for ethical practice. Couples and relationship therapy. Sex therapy often involves working with couples, as sexual issues rarely exist in isolation from the broader relationship dynamics. When one partner experiences a sexual dysfunction, it invariably impacts the other partner and the couple's overall intimacy. Couples therapy in a sexual context focuses on improving communication, fostering emotional connection, and addressing relational patterns that contribute to or maintain sexual problems. Therapists help partners understand each other's perspectives, express their needs and desires, and collaborate on solutions. It is crucial to address any underlying relationship conflicts, power imbalances, or resentments that may be manifesting as sexual difficulties. The goal is to strengthen the couple's bond and create a more supportive and sexually satisfying relationship. This collaborative approach recognizes the interconnectedness of partners. It aims to heal the relationship as a whole. Key interventions in couple sex therapy include sensate focus exercises, communication training, and exploration of sexual scripts. Sensate focus helps couples reduce performance anxiety and reconnect through non-demanding touch, gradually reintroducing sexual activity. Communication training focuses on teaching partners how to discuss sexual topics openly, respectfully, and empathetically, using I statements and active listening. Therapists also help couples identify and challenge their individual and shared sexual scripts, the unspoken rules and expectations about how sex should be. By understanding and modifying these scripts, couples can create a more authentic and mutually satisfying sexual life. Addressing issues like infidelity, trust, and differing libidos within a relational framework is also common. The therapist acts as a facilitator, guiding the couple towards greater understanding and intimacy. This comprehensive approach supports both individual and relational well-being. Professional development and supervision. Ongoing professional development and clinical supervision are indispensable for sex therapists to maintain competence, enhance skills, and ensure ethical practice. The field of sex therapy is constantly evolving, with new research, diagnostic criteria, and therapeutic techniques, requiring therapists to engage in continuous learning. This includes attending workshops, conferences, reading current literature, and pursuing advanced certifications. Supervision provides a crucial space for therapists to discuss complex cases, receive feedback on their clinical work, explore countertransference issues, and navigate ethical dilemmas. It offers a protective layer for both the therapist and the client, ensuring that challenging situations are handled responsibly and effectively. Professional growth is not a one-time event, but an ongoing commitment. It is vital for maintaining high standards of care. Supervision fosters reflective practice and prevents burnout. Supervision in sex therapy is often provided by experienced, certified sex therapists who can offer specialized guidance on sexual health issues. It helps therapists develop their clinical judgment, refine their intervention strategies, and increase their self-awareness regarding their own biases and comfort levels with sensitive topics. Peer consultation groups also offer valuable opportunities for shared learning and support, allowing therapists to collaborate and gain diverse perspectives on their cases. Engaging in regular self-care practices is another critical aspect of professional development, preventing burnout and maintaining personal well-being, which directly impacts therapeutic effectiveness. By prioritizing ongoing learning, supervision, and self-care, sex therapists can ensure they provide the highest quality of care to their clients while sustaining their own professional longevity and satisfaction. This commitment to growth benefits the entire profession.